biggest thing people need to recognize is that it's a journey. It's not, as you say, a quick fix that happens right away. Now, the drug itself, you will start with a ramp, starting with a low dose and gradually increasing as you get used to the drug to reach the point where it has an ongoing effect. The key challenge that people face and may not realize when they start the medication is that as soon as you stop the medicine, all of the previous appetite comes back. And so we're seeing that by itself, it's not a magic bullet that cures the problem. Even when you lose 15 or even 20% of your body weight after taking the medicine, when you stop the medicine, most of the weight will come back. And we're seeing people seesaw, and the seesawing ends up being pretty bad because when you lose weight, you're losing both muscle and fat. When you gain it back quickly, you tend to gain back the fat. So it's actually bad for you to seesaw back and forth with the medicine. And the good news is there is a path to keep the weight off, but it involves recognizing that you need to modify your lifestyle if you want the changes to be long lasting. That means you need to develop healthy eating habits and, more important, develop a lifestyle that includes exercise and management of the stress or the other issues in your life that may be encouraging you to eat more. The challenge of telehealth expectations that people have is that that's all they're going to do. They're going to have a quick visit to get the prescription, and that's all they have to do, which gets back to the first point. We talked about how for it to be effective, it needs to be part of a coordinated program. Now, the good news is that telehealth is just another way to see the doctor. And you could have a doctor set up a clinic and just gave a prescription and did nothing else in the office, just as you can do that in telehealth. So it's not the telehealth which is the limiting factor, it's the structure of the organization that's delivering the care. Thoughtful companies delivering healthcare via virtual channels are able to set up the same kind of lifestyle programs and interventions that cause people to be successful. So, for example, at HealthTap, we'll have a virtual primary care clinic where you connect with a doctor. The first visit is half an hour. You get to know your doctor. And if you embark on a GLP-1 journey, you're doing that with the doctor following you over time, giving you encouragement and helping you manage those changes in your lifestyle that are needed for the changes to be long lasting. But in general, participating with the program is the key element. And the telehealth companies that are doing that well engage their patients in those lifestyle changes, creating a relationship and ongoing care, which is really essential for there to be long-term benefits. Cost effectiveness does mean you have to know what the cost is. In other countries, the cost is significantly less than the retail cost of the brand name versions of the GLP-1 drugs here in the United States. If you look at the cost benefit analysis, there's actually an interesting study just reported this month in JAMA. The authors from the University of Chicago did a thoughtful analysis of what does it actually cost to use these drugs and versus the benefits. They did an analysis looking at the amount of money spent per life saved, which is a common metric used in these cost effectiveness studies. And what they showed is that it's a pretty high cost at the current retail price. But they also showed, if you read between the lines, if the price went down by half or by 2/3, then the drug becomes, in effect, cost effective. There have been other analyses that have looked at benefits that have been more liberal in their assumption of the benefits that would occur. For example, if you say, well, with successful weight loss, people who are overweight overuse healthcare resources, and people who are underweight don't, or people that have normal weight use fewer resources. And if you include those costs, not just the number of lives saved, but the healthcare costs that are avoided, some people have come up with lower estimates. But frankly, most people look at the estimates of benefit on the order of $200 to $300 per month. And the cost of the drugs is currently at the retail level about $1,000 a month. I could also mention that until recently, it's been possible to get the compounded versions at a lower price. It's not clear what's going to happen because the regulations currently require for compounding of trade name drugs is only available when the drugs are in short supply. And the limited supply based on the imbalance of high demand and not enough capacity to supply led them to be in short supply and declared by the FDA to be in short supply, which allowed compounding pharmacies to deliver at a much lower price. I've seen less than $300 per month as the price. However, the FDA has recently taken these drugs off the FDA short list, drugs in short supply list. And so it appears that compounding pharmacies are not going to be able to continue doing that on an ongoing basis. If I may, the bottom line is that when the drugs fall in price, they will be more cost effective, and they're already cost effective in other European countries. And I would foresee in the future the prices will come down. We see this traditionally with new categories of medicines that come out initially at a high price, and then as competitors come along and as we approach the end of the patent life of the trade name, the price of these drugs can fall dramatically. So I would certainly look forward in the future to seeing these drugs at a much more affordable level and a level that is clearly cost effective for their use.